Welcome, welcome, welcome. This week, we are going to talk about autoimmune diseases. Everything you really need to know about autoimmune disease. We're going to cover the most common types, why is it increasing, and so much more. Now, I'm going to be sharing my screen. So if you are watching this, you know, through any other way other than YouTube, please make sure you come to YouTube or somewhere where you can see the screen because there's going to be lots and lots of graphics that we are going to use, but also it'll be okay if you are listening to it. So we're going to dive right into this. Autoimmune disease. What should you know about autoimmune disease? So here's what we are going to cover for this topic. One, how common is it? Next, who does it actually impact? What are the most common types of autoimmune diseases? Why do we get these to begin with? Is there anything we can do about it? And then lastly, preventing autoimmunity in our children, right? So I assume there's no little kids watching this. It's pretty much adults of varying ages. And we want to be able to prevent, especially those who are in childbearing years and are likely going to have kids. What can you do to actually reduce the likelihood your kid gets an autoimmune condition? First, how common is autoimmune disease? Now, depending on the research you look at, it's estimated that anywhere from 5 to 8% of Americans have an autoimmune disease. Another research says nearly 50 million Americans have autoimmune disease, and these numbers are going up. Okay. They are becoming more and more common than they used to be. Now, this is a really big issue, and we're going to talk about what can we actually do about this. Who actually gets these autoimmune conditions, right? If they're going up, they're becoming more common. Who is at risk? Well, the answer really is it's everyone. But specifically, females have a 3 times greater risk of an autoimmune condition than a male. It also can impact people of any and all ages. You have little kids who can get it, but you also have full grown adults can also get it. So pretty much the entire spectrum. Yes, it may funnel in to young adult to mid adult, but it really is any age. Now, the other thing to know is that if you have one autoimmune condition, your risk of a second one goes up a lot. Now, if you have a family member as well who has an autoimmune condition, then guess what? You also have an increased risk. Now, when I say family member, so I'm saying if your mom or your dad or your sibling, not if your cousin had it, okay? It's not that closely linked. But mom, dad, or sibling, your chance does go up. Now, when I say your chance goes up, it really is for autoimmunity in general, with thyroid autoimmunity being the exception. Thyroid autoimmunity does tend to run in females. But if your mom has rheumatoid arthritis, then yes, you have a higher risk of any type of autoimmune disease, not specifically rheumatoid arthritis, though. So, what are the common symptoms that people are going to their doctor for that ultimately gets them a diagnosis of an autoimmune disease? Now, it should be known that on average, it can be anywhere from 4.5 years, and some research even as high as 10 years for someone to get a diagnosis for an autoimmune condition. So these people are struggling. They're bouncing around from one provider to the next, and this may be you. So, as you can see, the symptoms, I'm not going to read them all, but needless to say, they don't feel good. Fatigue, brain fog, muscle aches and pain, headaches, mood changes, they just don't feel good. And they know they don't feel good, but yet it takes them so long to get answers and solutions and even get diagnosed to begin with, which isn't even a solution, but it's at least a start. And as we go through this, you are going to understand why it takes people so long to actually get diagnosed. Now, when we look at autoimmune conditions, there are over 140 known autoimmune diseases. And it's important to know that we can't even test for all the potential autoimmune conditions out there. But there are 5 common autoimmune conditions that I want you to know about. We're briefly going to cover each one. Now, once again, there's way more than this, but thyroid autoimmunity, type 1 diabetes, rheumatoid arthritis, IBD, so inflammatory bowel disease, and then multiple sclerosis. When we look at thyroid autoimmunity, there's really 2 different types of thyroid autoimmunity. There's Hashimoto's, which is what most people are aware of. And if you have a low thyroid, you're on a thyroid medication, levothyroxine, tyrosine, something like that, then guess what? Or Synthroid, this means it's because your thyroid is too low and it's not producing what it should. The most common cause of a low thyroid is autoimmunity to your thyroid. So that's one, right? Hashimoto's is typically going to be low thyroid. But you can also have Hashimoto's with an elevated thyroid. Now, the most common cause of elevated thyroid is Graves' disease. So Graves' disease causes the thyroid to produce way too many hormones. And this is very devastating for people when they have it. Okay. Hashimoto's low thyroid usually is going to make you feel bad. But Graves' disease, on the other hand, is actually life-threatening if it's not treated. So those are the 2 that you should know about for thyroid. Next, type 1 diabetes. Your pancreas, the little guy here that's screaming for help, it's responsible for producing insulin. Now, when you have type 1 diabetes, the pancreas, specifically the part that produces insulin, known as your beta cells, they get damaged and they're not able to produce insulin anymore. And you don't get diagnosed with type 1 diabetes essentially till you have a blood sugar crisis where you are way, way too high, potentially life-threatening too high, because your body's done everything it can to make up for it. Now, this used to be called juvenile diabetes because it happened to people when they were younger and they were growing up. But they no longer call it that. And the reason why is because we are seeing more and more adults actually getting type 1 diabetes. Now, there's different reasons for that. And then the other thing is there are those who've been told they're type 2 who really have to use insulin or they cannot keep things appropriate. A lot of those have actually tipped into the type 1 diabetes, or even known as a type 1.5. Rheumatoid arthritis. Rheumatoid arthritis is an autoimmunity that impacts your joints. So the most common joints really are your hands, so your fingers, your wrists, and then your feet. It can also impact other joints throughout the body, but beyond that, it can create a wide variety of other symptoms that people are experiencing. Now, you may be wondering, okay, when am I going to talk about the juicy stuff? Don't worry, it is coming up. But I want you to understand what are the most common types of autoimmune conditions and where does it actually impact in the body? Inflammatory bowel disease. Now, with inflammatory bowel disease, there's 2 different types. You have Crohn's disease, which can impact anywhere in the digestive tract, and ulcerative colitis. Typically, Crohn's disease can impact people in their teenage years, even into adults, whereas ulcerative colitis usually is more adults. But both of these do come at an increased risk of colon cancer. Now, the other thing, which is why I have such a passion of helping people who have this, is when I was in school, so I'm licensed as both a doctor of chiropractic and a nurse practitioner. Now, in order to become a nurse practitioner, you have to go through nursing school. And in nursing school, we were learning about inflammatory bowel diseases. And what made me really, really upset was as we're studying and we're learning in the textbook, it was estimated at that point in time, 75% of those with inflammatory bowel disease would end up getting at least one bowel resection. What? Like, people are spending tens of thousands of dollars, if not $100,000 a year through insurance coverage and everything else to treat Crohn's and ulcerative colitis. But yet the bowel resection rate was that high. I consider that an absence of treatment. Actually, that's an epic failure to have that type of surgery rate. So latest research is really showing 50 to 80% of Crohn's, which is astronomical and is way too high. This should be considered a failure, not a success. And then ulcerative colitis is 30%. Once again, should be considered a failure, not a success, but definitely nowhere near as bad as Crohn's disease because there's so much more that we can do. And unfortunately, I do see people who have Crohn's disease who they've done everything they were supposed to and they weren't getting better, which we're going to talk about that just with autoimmunity in general. When you do everything you should and you can't get better. Now, the last autoimmune disease we're briefly going to touch on is multiple sclerosis. Multiple sclerosis is the most common autoimmune condition for your nervous system. Now, when we look here, you know, if you imagine you're like stringing beads on here, right? You've got this one that's a little bit brownish. That is fat that surrounds your nerves. That is known as myelin. Here, you see the myelin's been chewed up. So when your body attacks the myelin, it damages it. Now, the more fat you have around a nerve, the faster it sends signals. So when people have issues with multiple sclerosis, they have a lot of issues from dizziness to visual issues to pain, right? Sensory, vibration, all of that, brain fog, fatigue, and so much more. Now, the average onset for this is between the ages of 20 and 40. I have seen people younger than that, and then there can be people a little bit older than that as well. Now, before we can talk about what you actually need to do to get your autoimmune condition to a better spot or to prevent it to begin with, we need to understand that there's stages of autoimmune disease. When you look at the research, this will look a little bit different based upon the type of autoimmune disease. You can find different things in the research. But we are going to go with, right, you've got your initial, which we call stage 0. That is someone who's completely healthy. There's nothing, period. Then you have stage 1. Stage 1 means you have immune markers that are present, but you have no symptoms. So a good example of this is with Hashimoto's. The two most common autoimmune markers for Hashimoto's is TPO, thyroperoxidase antibodies, and thyroglobulin antibodies, with TPO being more common than thyroglobulin. So this would mean you're going in, you've got a doctor who's super preventative, right? And they look and they're like, oh, well, you have markers to your thyroid, but you have no symptoms. So that would be stage 1. Next, stage 2 would be immune markers with no symptoms, but no further findings. So now imagine you've got TPO and you're like, hey, you know what, doc, I don't have the energy I used to have. I've got some headaches. My motivation's down. My bowels are a little sluggish and it's difficult losing weight. And then they check the rest of your thyroid and like, hey, you know what? Your thyroid looks good. So, that's where you're at, right? You're at stage 2. Lastly, stage 3. Stage 3 is full-blown autoimmunity. Okay. This is, you have all the autoimmune markers. So let's go back to thyroid, TPO, right? Thyroglobulin. You've got the symptoms, and then you've got the testing that shows your TSH is way up and your T4 is really low. And at this point in time is when they're finally going to treat you. But why are we waiting for people to have so much destruction that their body can't do it anymore to treat them? Especially with something like thyroid. And this is really concerning because when I was in nurse practitioner school, we were learning about medicating someone for their thyroid. And they brought up that you could test for thyroid autoimmunity. And then they said, well, you can, but it doesn't really matter because at the end of the day, if they have a low thyroid, here's the medication you're going to give them. We're not going to do anything specifically to treat the thyroid autoimmunity. And what did we learn earlier, though? It's if you have one autoimmune disease, your risk of another one goes up. So we should be measuring the things we can measure to be preventative. Now, when we look at labs, it's really important to remember that because there are so many different autoimmune conditions, we cannot measure everything we need to. Yes, thyroid autoimmunity tends to be pretty easy. But on the other side, if we look at multiple sclerosis, how is that normally diagnosed? Imaging, usually an MRI, CT scan, And then a lumbar puncture, actually, spinal tap. You're not just going to randomly spinal tap people to see where they're at. Now, maybe in the future, there will be really good labs that let us know someone's heading down the wrong path with multiple sclerosis. But right now, we don't really have that. So some of the things that can be measured, cool. But there's others that can't, right? So most people, if they're worried about autoimmunity, they've had a CBC. They've had a ANA, anti-nuclear antibodies. Now, anti-nuclear antibodies are not perfect. This does not pick up any and all autoimmune conditions. So for that reason, if it's highly suspicious that someone's got autoimmune conditions and things just aren't looking right, and you just don't think you're getting the full story you need from your labs, then you know what? Sometimes it's best to just live your life and go through the process as if you do have an autoimmune condition versus leaving it to chance. Now, before we go into treatment that I would think is good treatment, we're going to start at traditional treatment and really look at this, right? So if you go and see a medical doctor, a nurse practitioner, or PA, and if they're only using what they were taught in school, what are you likely going to get? One, you're not going to get any treatment at all until you hit stage 3 of your autoimmunity. So you have to have lab markers, symptoms, and unfortunately, there's usually going to be damage that has occurred by the time you get anything. Next, a lot of the treatment is often based around symptoms. Now, there is some new treatment that is meant to modify the immune system, but for years, the treatment was all about suppressing the immune system and trying to say, immune system, I'm going to squash you. And that's why on every single commercial, what did it always say about autoimmune medications? And it even says it now with most of them. Increased risk of infections and increased risk of cancer because you are messing with the immune system in a way that's actually not healthy, right? We don't want to squash the immune system. We want to balance the immune system. It's like if you play a sport, right? We don't want there to be only offense and no defense. We're just like, hey, we need to be equal, right? Like I love soccer. If you try to go way too much on one side and you ignore the other side, it's not great. So it's really about balancing it out. And then lastly, there's no talk about lifestyle recommendations. The amount of patients I've had come in and said, hey, my doctor said what you eat doesn't matter. Just kind of do your own thing. It's really concerning because guess what? You're kind of dependent on the medical system and you feel you have no control. But is that true? And the answer is no, it's not true. You do have plenty of control, which is where we are going next. Now, something I want you to think about is if you can understand what causes an autoimmune condition to develop in the first place, then guess what? Could we not say this is how it should actually be treated? Think about it, right? What were the things that led to autoimmunity? If we address those, then we can use those same things to get autoimmunity underneath better control. Now, we're going to use multiple sclerosis. Now, I had one for each and every one of these, but we'll do a separate podcast on this where we go through each and every one. But multiple sclerosis, what are the different risk factors that can trigger multiple sclerosis to begin with? There's not one, right? There is many. You've got weight, you've got smoking, you've got pathogens, so infections, you've got the gut microbiome, you've got lipids, you've got hypertension, you've got genetics, diabetes, diet, and physical inactivity. So there's not one trigger of an autoimmune condition. So you may have multiple things here that are at play. When we look at triggers, exposure matters. So the next few are all going to be coming from Dr. Riso Vijdani, who's a PhD immunologist, and through some of his papers. Now, you have things that impact you externally, and then you've got things that impact you internally, right? So stress, lifestyle, the foods you eat, even medications can increase your likelihood of autoimmunity. Air pollution, you've got infections, right? You've got all sorts of things that can do it. Now, I know some of you are like, but what about genetics, right? I was told genetics is what matters the most. If I had a family history of it, it increases my risk. And once again, increases. It is not deterministic. And as you see here, genetics is a part of what can contribute to autoimmune disease, right? Genetics, infections, gut microbiome, toxic chemicals, and dietary components. Now, when we look at toxic exposure, what are the things we see, right? We get solvents, we have pesticides, we have herbicides, we get different metals, we get silica, we get smoke. This ultimately comes in here and can mess with the immune system. And then as a result of it messing with the immune system, then you can develop autoimmunity to different tissues based off that. Now, what about it from a gut perspective? So in the natural health world, there's a lot of talk about autoimmunity via the leaky gut. So what are things that really messes with the health of our gut? You have stress, you have toxins, once again, infections, you have foods, you've got medications. Okay. When we look at this, we've got intestinal mucosal cells. So when we see this, you've got what's called normal tight junctions. This controls what goes in and out of the intestines, right? And when it's healthy, guess what? You prevent what you don't want getting through. But when it's been damaged, and that's why they call it a leaky gut, leaky and inflamed, you now get entrance of all of this stuff that you don't want in here, comes in here, disrupts the immune system. You may get food allergies. You may get joint pain. You may get fatigue. You may get headaches. But for some people, they actually tip into an autoimmune disease because of their leaky gut. So gut health is going to be critical, and we are going to be talking more about gut health and what you can do with that. Now, once again, right? Genes, right? Genes do play a role. Also, gut health plays a role. We see medications, right? NSAIDs, so ibuprofen, aspirin, Advil, Aleve, PPIs, your Nexium, your Prilosec, right? Lots of those. They do mess with your gut and increase the likelihood of autoimmunity. And then there's even research on gluten, alcohol, and other things like that. Ultimately, all of these can go in, can create systemic inflammation, disrupts the immune system, and can lead to an autoimmune response. Now, you may be wondering, man, that's very depressing. There's a lot of things that can happen. And yeah, there are a lot of things that can happen. But what can you do about it? As we talked about, if you know the triggers, then you get power, right? You get power to take control of your future if you understand the triggers and you're willing to do the work to address them. Sometimes we look at what more do we need to do, right? What can I add in? What nutritional supplement can I take? What medication can I take? But it's not always about what you should be adding in or what you should be taking. Sometimes it's about what should you be removing. When we look at this research article, it looks at ultra processed foods, right? Ultra processed foods. You think about most of fast food restaurants, you think about the artificial sweeteners, you think about the dyes, all of that stuff. This is going to disrupt the makeup of your gut bacteria, causing dysbiosis. This is going to hurt so you've got this mucus lining in your intestines. It's going to hurt that. Ultimately, it's going to create intestinal permeability and disrupt the tight junction, and leading to more inflammation to create, guess what? Issues. So change your nutrition, okay? If it didn't exist 100 years ago, don't eat it, right? Like grass-fed beef, wild caught fish, good nuts and seeds, olive oil, right? Fruits, vegetables, eat it. But if it has to go through 100 steps and they have to put all of this stuff in there so it looks okay, it's not okay. We are paying a price. Convenience is costly. But the other thing is, it's not as hard as we think to eat healthy. The food industry just wants us to believe that it is. Because if they can get you to believe that it's easier to eat unhealthy than healthy, that's where you will go. But in reality, I eat healthy. Yeah, initially it was a learning curve. But once you do it, you're like, man, it's really not as bad as we've been led to believe. Now, one of the big things that you'll likely read if you research autoimmunity, especially if you start looking in the natural health community, it's going to be about removing gluten. So this going back to Dr. Risto Vichdani and some of his research is you have gluten can create a wide variety of issues, and I'm not going to read all these, but you can see different symptoms and conditions. Now, one of the reasons it creates different conditions is because our body responds to different chemical structures, okay, different proteins. If it looks enough like something else, that's called cross reactivity. So anytime you eat gluten, your body's immune system is going to attack something else that looks like it. Now, this does not mean that every single person has issues with gluten, but the amount of people that do is really, really high, especially in the autoimmune world, or those with chronic neurological symptoms as well, like migraines. Next, go along with gluten. And if you're going to do this, it's really best to just pull out both gluten and dairy, because dairy does create a lot of issues as well in many of the same ways that gluten does. And then a bonus tip for the moms out there and the dads, if you have a little kid who gets ear infections and they're getting cow's milk, just stop it. The amount of kids with ear infections because of cow's milk is crazy. Like, I've known people whose kids were getting chronic ear infections. I'm like, look, just stop the dairy. And next thing they're like, well, my kid never got another ear infection. And it's because, look, that's creating a lot of issues. Make those changes. So pull it out. Now, we've talked about things that we need to pull out of our nutrition, right? Gluten, dairy, ultra processed foods. But something we need to do, and you will get as you diversify your diet, have lots of good fiber, it's what's called short chain fatty acids. Short chain fatty acids are massive regulators of the immune system. Specifically, short chain fatty acids such as butyrate is one of the most important. And you'll see here, beyond celiac disease, inflammatory bowel disease, multiple sclerosis, rheumatoid arthritis, lupus, type 1 diabetes, and much more, it shows you what these do within the immune system. Now, if you eat healthy, you are going to do this. You need to have a good diversity of your gut microbiome, because it's your microbiome which ultimately ferments those prebiotics, okay, and the non-digestible fibers, and creates short chain fatty acids that are then used to help regulate your immune system, reduce inflammation, but also supports your colon with good health. Now, what are other things that you could remove? Well, if stress is a trigger, if every time you get stressed, you get joint pain, you get headaches, right? You get fatigued, then work on reducing stress. Now, I get it. You may not be able to remove all of the stress in your life, but I have yet to talk to someone who has not had a place that they could have improved with their stress. Most of them did. Now, sometimes it's hard removing those people or those situations out of your life, but it can be done. Next, lifestyle, right? Changing the way you're eating, alcohol, social habits, staying up late, just do it. Now, indoor air pollution, you can get good quality air filters in your house that are very, very strong HEPA that can remove 0.01, 0.02 microns particle size. That does a really good job. And then outdoor air pollution. Now, I get it. You can't control this as much. And so that's why everything else matters a lot. Medications, really, as you get healthier, people need to be on less medications. So there's less side effects. The amount of people who are taking PPIs, Nexium, and stuff like that, because they won't change their nutrition, is really high. Because we were never meant to be on those medications long term. They were never researched for that. They were researched for short term use. So those are things that you can remove to get to a healthier space, right? You can work on your drinking water supply. There's all sorts of water filters you can get. There's even whole house systems that you can do to reduce your exposure to things. As you reduce your exposure, things improve. Most people are looking for, like, what's that one thing I can do? What's that one thing? Well, it's usually not one thing, but it's a combination. When you add them up, these move the needle and get you to where you want to be. Now, exercise. Oh man, dreaded exercise. You knew it was going to come up, right? The essentials of life. Okay, I've got 5. How do you eat, sleep, stress, exercise, and socialize? Get all 5 of those in line, you are going to do a lot better than if you don't. So, exercise, even if you have things like arthritis, are beneficial for you. Now, what this research study did is they looked at the benefits from an anti inflammatory spot of doing exercise. And exercise does reduce the amount of inflammation in the body. And they tell you, right, 2 times a week, 3 times a week, what was it researched on? Some of it was weight, some of it was aerobic, some of it was like yoga and stuff like this. Now, you shouldn't go necessarily insanely hard, but an absence of exercise, as we know, being sedentary, can be a trigger for autoimmune condition, as well as it progressing and continuing to go and not be under control. So exercise is critically important as well. Now, preventing autoimmunity. If you have been impacted by autoimmune condition and you know what it's done in your life, there's nothing more important than helping to prevent the likelihood it goes to future kids. Okay. Maybe you've got a little kid now, that still applies, but even future kids. So part of preventing it starts with what you're exposed to when you're pregnant. Then it goes to type of birth, right? Vaginal versus C-section. I personally wish we would ban most C-sections. Okay. They're super expensive. They're not good for the kids. And they actually have they're not great for the mom either. Okay. They're not the best route. They're usually done out of convenience, and it's not setting kids up for their best potential future. Next is breastfeeding at all cost, right? If there's a way to potentially do it, it needs to be done. You cannot substitute formula for breast milk, because as we see here, from the time a kid's born, they are going to get shifts in their gut bacteria, which is going to help develop their immune system. And based upon birth, formula versus breastfeeding, this is going to shift them to a healthy gut bacteria or a unhealthy gut bacteria. Now, what are things that you may be exposed to when you're pregnant with your kid, or that your kids could be exposed to after, that also can impact them? Well, same things we kind of already talked about, right? Antibiotics, PPI, so basically acid blockers, question marks on some other things, right? From antidepressants to acetaminophen, hormones and stuff like that. So those are question marks, but for sure, antibiotics, PPIs, stuff like that. These ultimately, once again, impact the diversity of your child's gut, changes their immune system. And as a result, maybe they end up with allergies. Maybe they end up with an autoimmune disorder. Maybe they end up with depression or something like that. Maybe they end up with infections. Maybe this increases the risk for diabetes. But at the end of the day, the best thing we can do to set our kids up for a bright future: vaginal birth, breastfeeding, good, healthy nutrition, preventing unnecessary stuff. And it's why I'm not even a big fan when people are pushing for antibiotics for their kids' ear infections. A lot of those will actually self-resolve in a few days. I get it. It's frustrating when kids are running a high fever and they're screaming like crazy. But usually if people are removing the dairy and other stuff, the amount does go down. And there's other things you can do beyond antibiotics that I personally use for treatment, right? For when my kids had it. And then there's other things you can do to make sure that their eustachian tubes are draining well. So that is what you really need to know about autoimmune conditions. Yes, they're on the rise. Yes, they're continuing to go up. But we know now a lot of the things that act as triggers. And because we know what acts as triggers for autoimmune conditions, we now can gain control of keeping it under control and not feeling hopeless. Because a lot of people feel hopeless because they're doing what their providers tell them. They're on super expensive medications. Like some of the new IVs, I mean, they're $25,000 every time people get them, whether it's once a month or every 3 months. I mean, that's astronomical. And for what's being spent, honestly, the outcome should just be way better. And there's more that we can do to help people not get there, right? We've talked about the stages of autoimmune condition. If you can detect autoimmunity in the early stages and be preventative, and to maybe you were going to get it no matter what, right? But if we can prevent it from occurring for another 5, 10 years, that means a lot because those with autoimmune conditions, they do suffer. It takes them a long time to get help. And even when they are getting help, they're usually struggling and they're like, well, I mean, like, here's how I feel, but I don't feel great. If you have any questions, let me know. And if there's any future topics you would like me to cover, please go ahead and comment on this video. I'll go and check those comments. And until next time, this is Dr. Z.